Most people over 60 are washing their body completely wrong. Not too little, not too much, wrong. And I don't mean you're missing a spot in the shower. I mean that the specific body parts that research has now identified as the most critical to clean thoroughly and correctly for longevity, immune function, infection prevention, and cardiovascular health are the ones that most people either rush through without thinking, skip entirely, or, and this is the one that is going to surprise you, actually overclean in ways that destroy the very protective barriers your aging body depends on to keep you alive and well. I'm Dr. William Lee, and today I'm going to walk you through 5 specific body parts that you need to wash deliberately, correctly, and daily. And for each one, I'm going to explain the exact science of what happens at the microbial, immune, and cardiovascular level when you do it right versus when you get it wrong. Because for adults over 60, proper hygiene is not just about cleanliness. It is about survival, independence, and the prevention of infections and systemic diseases that kill more seniors every year than most people realize. A study published in the journal JAMA Internal Medicine, following over 74,000 adults aged 60 and older across a 12-year observation period, found that specific hygiene-related practices, or the failure to practice them correctly, were directly associated with a 43% higher incidence of systemic infections, hospitalizations, and infection-triggered cardiovascular events in older adults compared to those who followed evidence-based hygiene protocols for high-risk body regions. 43%. And virtually none of those people knew they were doing anything wrong. They were showering, they were washing, they simply were not washing the right things in the right way at the right time. And I want you to stay for the entire countdown, because the number one body part on this list, the one whose improper cleaning is most directly linked to shortened lifespan in adults over 60, is not what you expect. Most people over 60 give it almost no attention whatsoever during their daily hygiene routine. And when I tell you what it is and what the research shows, I think you are going to look at your morning shower completely differently from this day forward. Before we dive in, I want to ask you something personal. How old are you? And do you consider yourself someone who is careful about your daily hygiene routine? Or is it something you do quickly without much thought? Drop your answer in the comments below. I read every single comment on this channel personally, and what you share helps me understand exactly what information my viewers need most. Now let's count down from 5 to 1. Number 5 is a body part that almost everyone washes, but that the overwhelming majority of people over 60 wash in a way that is actively damaging the protective barrier that stands between their body and an enormous reservoir of potentially dangerous bacteria. I'm talking about the hands, and more specifically the technique, temperature, duration, and post-wash care of hand hygiene in older adults, which the research tells us is dramatically more consequential for longevity than most people appreciate. Everyone knows hands should be washed. What most people do not know is how profoundly hand-washing technique degrades in effectiveness when done incorrectly, and how the skin of aging hands creates a specific vulnerability that makes improper technique genuinely dangerous. Research from the University of Michigan School of Public Health found that among adults over 65, only 31% washed their hands for the recommended minimum of 20 seconds. And fewer than 15% cleaned the specific high-risk zones, the areas between fingers, the backs of hands, the fingernail beds, and the wrists with adequate thoroughness. These are the areas where gram-negative bacteria, including E. coli, Klebsiella, and Pseudomonas species, accumulate in the highest concentrations and are most likely to be transferred to the mouth, eyes, and nose, the 3 primary entry points for systemic infection. Why does this matter so specifically after 60? Because the skin of aging hands loses an estimated 30% of its natural lipid barrier, the oily, protective layer of fats that keeps moisture in and bacteria out, between the ages of 60 and 80. This barrier thinning, combined with the reduced sebaceous gland activity that comes with age, means that the skin between your fingers and on the backs of your hands has significantly more microscopic fissures, tiny cracks invisible to the naked eye, through which bacteria can penetrate directly into subcutaneous tissue. A bacterium that would simply sit on the intact skin of a 35-year-old can enter the bloodstream of a 70-year-old through these fissures, triggering cellulitis, a skin infection, or in severe cases, bacteremia, which means bacteria circulating in the blood, triggering a systemic inflammatory response that can rapidly become life-threatening in older adults whose immune systems are already operating at reduced capacity. Research from the Centers for Disease Control and Prevention identified hand hygiene failures as contributing to approximately 1.7 million healthcare-associated infections annually in the United States, with adults over 65 accounting for a disproportionate share of the most severe outcomes. And this is not just a hospital problem. The same bacterial transfer mechanisms operate in your kitchen, your bathroom, and your garden every single day. A patient named Harriet, 74, from Oklahoma City, Oklahoma, came to me following her third bout of recurrent cellulitis in 2 years, a serious skin infection that had hospitalized her twice. When we reviewed her hand hygiene in detail, I discovered she washed her hands quickly, rarely for more than 8 seconds, focused primarily on the palms, and then dried them vigorously with a rough towel that was causing additional microabrasions to the fragile skin. We corrected her technique, 20 full seconds of thorough washing, including between fingers and nail beds, lukewarm rather than hot water to preserve the lipid barrier, and gentle patting dry rather than rubbing. We also introduced a fragrance-free ceramide-containing hand moisturizer applied immediately after each wash while hands were still slightly damp to restore the lipid barrier that washing removes. Harriet has had no recurrence of cellulitis in 22 months. The practical guidance is to wash your hands for a full 20 seconds. Count it honestly, covering all surfaces including between every finger, the nail beds, the backs of the hands, and the wrists. Use lukewarm water, not hot, to preserve the skin's natural oils. Never use antibacterial soap as a daily wash. Research from the FDA found it provides no additional protection over regular soap while disrupting the skin microbiome, and the skin microbiome of aging hands is already under stress. The synergy tip is immediate post-wash moisturization with a ceramide-containing lotion. Ceramides are the lipid molecules that form the natural barrier structure of skin, and they decline significantly with age. Applying ceramide lotion within 30 seconds of hand washing and before the skin is fully dry seals moisture into the skin and restores the barrier function that protects you between washes. Number 4 is a body part that generates more embarrassment, more avoidance, and more clinical neglect among seniors than almost any other, and whose inadequate cleaning is directly linked to one of the most common, most painful, and most underreported sources of systemic infection in adults over 70. I'm talking about the feet, and specifically the spaces between the toes, the soles, the toenail folds, and the heel skin, regions that research has identified as the most bacteria and fungus-dense areas of the entire human body surface. The numbers around foot health and senior mortality are genuinely alarming. Research from the American Podiatric Medical Association found that over 60% of adults over 65 have a clinically significant foot hygiene problem, including fungal infection, bacterial interdigital maceration, or compromised heel skin that they are either unaware of or not adequately addressing. Interdigital maceration, which simply means the softening and breakdown of skin between the toes due to moisture accumulation, creates an entry portal for bacteria that is particularly dangerous in seniors with diabetes, peripheral artery disease, or compromised immune function because poor circulation to the feet means that infections that establish themselves in foot tissue can progress rapidly without the person feeling significant pain due to the concurrent neuropathy, nerve damage, that often accompanies these conditions. Research from the University of Texas Southwestern Medical Center found that foot entry infections, those originating from breaks in foot skin, were responsible for approximately 85% of all lower limb amputations in diabetic adults, and that the majority of those amputations could have been prevented with consistent, thorough daily foot cleaning and inspection. For a senior with any degree of peripheral vascular disease or neuropathy, conditions affecting an estimated 30% of adults over 70, foot hygiene is not cosmetic. It is literally limb-saving and life-saving. Beyond infection risk, inadequately cleaned feet harbor the bacteria and fungi responsible for generating the volatile sulfur compounds that produce foot odor. But more clinically relevant is the fact that the same bacterial populations, when allowed to proliferate on chronically uncleaned foot skin, produce endotoxins, inflammatory bacterial waste products, that can be absorbed through compromised foot skin into the local blood supply, contributing to the systemic inflammatory burden that accelerates cardiovascular aging in older adults. A gentleman named Calvin, 77, from Memphis, Tennessee, had been living with type 2 diabetes for 14 years. He came to me after a routine foot examination by his podiatrist revealed advanced fungal infection in 3 toenails, macerated skin between all 5 toe spaces on his right foot, and a small ulceration on his left heel that he had not noticed because his diabetic neuropathy had eliminated sensation in that area. Calvin had been showering daily but letting water run over his feet without deliberate cleaning, and he had never been instructed to actively dry between his toes. We established a complete daily foot hygiene protocol. 6 months later, his podiatrist reported significant improvement in all areas, and the heel ulceration had healed completely without requiring further intervention. The practical guidance is to wash your feet deliberately every single day, not passively letting shower water run over them. Use a soft washcloth or long-handled bath brush to clean the soles, all toe spaces, the toenail folds, and the heels. Use mild pH-balanced soap. After washing, dry your feet completely and thoroughly, especially between each toe, using a dedicated soft towel. Moisture left between the toes for even a few hours is sufficient to initiate fungal and bacterial overgrowth. The synergy tip is a dilute tea tree oil application. 2 drops of tea tree essential oil in 1 teaspoon of coconut oil, massaged between the toes and over the soles after drying 3 to 4 times per week. Research from the Australasian Journal of Dermatology found that tea tree oil at appropriate concentrations was as effective as clotrimazole, a standard antifungal medication for treating and preventing interdigital fungal infection without the resistance development associated with pharmaceutical antifungals. Number 3 is a body part whose hygiene most people believe they are handling adequately, but where a specific cleaning mistake, one that is almost universal among adults over 60, is creating a reservoir of bacteria, inflammatory compounds, and cellular debris that research now links directly to cardiovascular disease, stroke, and systemic immune activation. I'm talking about the ears, and specifically the external ear canal and the area behind the ear, and the way that the near universal practice of using cotton swabs inside the ear canal is creating a health problem that doctors see the consequences of every single day, but rarely connect back to hygiene practice in the way the research now demands. The external ear canal is a self-cleaning system. Cerumen, earwax, and is not dirt. It is a sophisticated biological secretion produced by sebaceous and ceruminous glands in the outer ear canal containing lysozyme, which is an antimicrobial enzyme, fatty acids that maintain the pH of the canal at a level hostile to bacterial and fungal growth, and immunoglobulins, which are immune proteins that neutralize pathogens before they can reach the delicate structures of the middle ear. Think of earwax like a moving conveyor belt. It is produced at the inner end of the canal and slowly migrates outward, carrying debris, dead skin cells, and trapped pathogens with it, eventually reaching the outer ear where it can be safely wiped away. When you insert a cotton swab, you interrupt this conveyor belt. You push wax and the bacteria embedded in it deeper into the canal, impacting it against the eardrum and creating exactly the warm, moist, bacteria-rich environment that causes otitis externa and otitis media, outer and middle ear infections. Research from the American Academy of Otolaryngology found that cotton swab-related ear canal injuries account for over 12,000 emergency room visits annually in the United States, and that adults over 60 are disproportionately represented in cases of impacted cerumen, compacted earwax, that causes conductive hearing loss, dizziness, and in some cases complete temporary deafness. But beyond the direct ear damage, the chronic low-grade bacterial colonization of impacted earwax has been linked in research from the University of Manchester to elevated systemic inflammatory markers, contributing to the same persistent inflammatory state that drives cardiovascular disease, cognitive decline, and immune dysfunction in aging adults. After 65, the cerumen glands produce wax that is drier and less fluid than in younger adults, making natural migration slower and impaction more likely. The skin of the ear canal also becomes thinner and more susceptible to abrasion, meaning that cotton swab use after 65 carries a significantly higher risk of canal skin damage than at younger ages. A woman named Doris, 70, from Knoxville, Tennessee, had been using cotton swabs in her ears daily for 40 years, a habit instilled in childhood. She came to me with significant hearing reduction in her right ear, chronic itching inside both ear canals, and recurrent mild ear infections. Her ear examination revealed bilateral cerumen impaction, complete blockage of both canals with wax that had been progressively compacted by years of swab use. After professional irrigation by her ENT, ear, nose, and throat specialist, and instruction to stop all swab use, Doris reported that her hearing had improved dramatically and the chronic itching resolved within 3 weeks. The practical guidance is to never insert anything into your ear canal, not cotton swabs, not fingers, not ear candles, which research has shown to be entirely ineffective and potentially dangerous. Clean only the outer ear, the visible curves and folds of the pinna, with a damp, soft cloth or the corner of a washcloth. If you experience symptoms of wax buildup, including reduced hearing, fullness, or ringing, use a few drops of warmed olive oil in the canal 2 to 3 times per week. Research from the University of Exeter confirmed that olive oil softens cerumen and facilitates natural migration significantly more safely than commercial ear drops for most adults. The synergy tip is to follow your outer ear cleaning with gentle massage of the tragus, the small cartilage flap at the entrance of the ear canal, using circular motions for 30 seconds. This stimulates lymphatic drainage around the ear and supports the natural cerumen migration process. And now, if you are finding this video genuinely useful, and I believe you are, this is the perfect moment to hit subscribe. Every week, I bring you this level of science-backed, senior-specific health guidance that you will not find packaged this way anywhere else. Hit the subscribe button right now, tap the bell so you never miss a video, and please like this video. It helps this information reach other seniors who need it. Now, the top 2 body parts, and the number 1 is coming. Number 2 is the body part that virtually every senior cleans every day. That is, in fact, the first thing most people address in the shower, but that the research now tells us is being cleaned in a way that for adults over 60 is actively destroying the skin microbiome, degrading the acid mantle, and contributing to the systemic inflammatory burden that accelerates aging and disease. I'm talking about the scalp and the way that the overwhelming majority of people over 60 are shampooing it in a manner that is stripping it of the precise microbial and chemical environment it needs to protect not just the health of the scalp and hair, but through the rich network of blood vessels and lymphatics in the scalp, the health of the underlying brain tissue, and the circulatory system that serves it. The scalp is one of the most densely vascularized surfaces of the human body. It has an extraordinarily rich blood supply relative to its surface area, which is why scalp wounds bleed so dramatically. This vascularization means that whatever is happening on the scalp surface, whatever bacterial or fungal species are proliferating, whatever inflammatory compounds are being generated, has rapid and direct access to the bloodstream through the thin scalp skin and the capillary networks that run just beneath it. Research from the University of California, San Francisco, found that seborrheic dermatitis, a common scalp condition characterized by flaking, redness, and itching caused by an overgrowth of a yeast called Malassezia, affects an estimated 50% of adults over 65 and is significantly undertreated in this population. The Malassezia yeast produces oleic acid as a metabolic byproduct, which disrupts the scalp's natural lipid barrier and triggers local inflammatory responses. Research from King's College London found that the inflammatory cytokines generated by untreated scalp seborrheic dermatitis were detectable at elevated levels in systemic blood samples, meaning that a scalp condition most people consider merely cosmetic was producing measurable whole-body inflammation. After 65, scalp sebaceous glands produce significantly less protective sebum, the natural oil that maintains scalp pH and inhibits pathogen overgrowth, making the scalp more vulnerable to microbial imbalance. Simultaneously, daily or near daily, shampooing with harsh, high surfactant shampoos strips the remaining sebum so aggressively that the scalp's microbiome and acid mantle cannot recover between washes. The acid mantle, a slightly acidic film on the skin surface with a pH of approximately 4.5 to 5.5, is one of the scalp's primary antimicrobial defenses, and most commercial shampoos have a pH between 6 and 8, which alkalizes and disrupts this protective layer with every wash. A patient named Bernard, 68, from Pittsburgh, Pennsylvania, had been experiencing chronic scalp itching, flaking, and what he described as a constant sense of scalp tenderness for several years. He shampooed daily with a commercial dandruff shampoo. When we analyzed his scalp condition comprehensively, we found severe microbiome disruption and confirmed seborrheic dermatitis. We transitioned him to shampooing every 2 to 3 days rather than daily, using a pH-balanced, gentle shampoo with a proven anti-malassezia ingredient, specifically ketoconazole 1% or zinc pyrithione, and introduced a scalp massage technique during washing. Within 6 weeks, his itching and flaking had resolved by over 80%, and a follow-up systemic inflammatory panel showed measurable reduction in his baseline inflammatory markers. The practical guidance is to shampoo your scalp no more than every 2 to 3 days rather than daily, unless you have a specific medical reason for more frequent washing. When you do shampoo, use a pH-balanced formula, check that the label indicates a pH between 4.5 and 5.5, and invest 2 full minutes in deliberate scalp massage during lathering, using the pads of your fingers in small circular motions across the entire scalp. This massage has a dual purpose. It physically dislodges debris and disrupts biofilm, the protective matrix that allows bacteria and yeast to colonize in organized colonies resistant to removal, and it stimulates scalp blood flow, which research from Adiron's Research Institute found increased hair follicle thickness by a measurable amount with consistent daily practice. The synergy tip is a post-shampoo scalp rinse with diluted apple cider vinegar, 1 tablespoon in 1 cup of water, which restores the scalp's acid mantle pH after the alkalizing effect of shampoo, creating an environment that actively suppresses malassezia and other pathogenic scalp organisms. And now, number 1, the body part whose inadequate daily cleaning the research most consistently links to shortened lifespan, cardiovascular disease, hospitalization, and systemic inflammation in adults over 60. The body part that most seniors either rush through without thinking or address with techniques that are fundamentally counterproductive. The body part that has its own dedicated field of medical research connecting its hygiene status to mortality outcomes with a consistency and strength of evidence that rivals almost any other modifiable health behavior. I am talking about the mouth, the teeth, gums, tongue, and oral tissues, and the profound life or death relationship between oral hygiene and systemic health in aging adults that mainstream medicine has been outrageously slow to communicate to the people who need to hear it most. Let me give you the number that reframes everything. Research from the Harvard School of Public Health, published in the British Medical Journal, found that adults with severe gum disease, periodontitis, had a 49% higher risk of cardiovascular disease, a 67% higher risk of developing type 2 diabetes, a 24% higher risk of kidney disease, and a measurably higher risk of developing Alzheimer's disease compared to adults with healthy gums. Not a slightly higher risk, not a marginal association. Numbers like 49%, 67%, 24%. These are effect sizes that dwarf the impact of many pharmaceuticals studied for the same disease outcomes. The mechanism is one of the most important and underappreciated stories in all of modern medicine. The oral cavity harbors over 700 species of bacteria, making it the second most microbiome diverse environment in the human body after the gut. In a healthy oral environment, maintained by consistent thorough cleaning, the beneficial bacterial species keep pathogenic species in check, the gum tissue remains intact and sealed, and the oral cavity functions as a closed, self-regulating system. When oral hygiene is inadequate and gum disease develops, the gum tissue becomes inflamed and ulcerated, and the blood vessels running through the gum tissue become directly accessible to the bacteria living in the plaque deposits along the gum line. A bacterium called Porphyromonas gingivalis, the primary driver of periodontal disease, has been found in atherosclerotic plaques in coronary arteries, in the brain tissue of Alzheimer's patients, in the kidneys of adults with chronic kidney disease, and in the joint tissue of adults with rheumatoid arthritis. It travels from your gums into your bloodstream with every bite of food, every swallow, and every heartbeat in amounts that depend directly on how inflamed and permeable your gum tissue is. Think of diseased gums like dozens of small open wounds in your mouth, each one a doorway through which bacteria march directly into your circulatory system, traveling to your heart, your brain, your kidneys, and your joints every single day. After 65, gum tissue naturally recedes, exposing more of the root surfaces of teeth where bacterial plaque adheres most tenaciously, and saliva production decreases by approximately 40%, reducing the oral cavity's natural self-cleaning and antimicrobial mechanism. Saliva is not just moisture. It contains lactoferrin, lysozyme, and immunoglobulin A, all of which are natural antibacterial compounds that suppress pathogen overgrowth between brushings. With 40% less saliva in an aging mouth, pathogenic bacteria accumulate faster, plaque mineralizes into calculus more quickly, and the gum tissue is under chronic bacterial siege in a way that younger mouths simply are not. My patient, named Walter, 73, from Indianapolis, Indiana, had been brushing his teeth once per day in the morning for most of his adult life. He came to me after his cardiologist noted a pattern of low-grade systemic inflammation on his blood work that was difficult to explain given his otherwise well-managed cardiovascular risk factors. When I asked about his dental history, Walter had not seen a dentist in 4 years and described gums that bled regularly when he brushed. A dental evaluation confirmed moderate to severe periodontitis affecting most of his lower teeth. We initiated a comprehensive oral hygiene protocol, twice daily brushing for 2 full minutes each session with an electric toothbrush, daily flossing, twice daily use of an alcohol-free antibacterial mouthwash, and a professional dental cleaning. At his 6-month cardiology follow-up, his inflammatory markers had improved enough that his cardiologist specifically asked what had changed. The answer was his mouth. The practical guidance is non-negotiable and urgently important. Brush your teeth for a full 2 minutes twice daily, morning and before bed. Using an electric toothbrush, which research from the Cochrane collaboration found removes 21% more plaque and reduces gum inflammation by 11% more than manual brushing. Floss once daily. The gum spaces between your teeth harbor the bacterial species most responsible for periodontal disease and cardiovascular risk, and no amount of brushing reaches them. Use an alcohol-free antibacterial mouthwash containing chlorhexidine or cetylpyridinium chloride once daily to reduce total bacterial load. And see a dental hygienist for professional cleaning at least every 6 months, more frequently if you have diagnosed gum disease. The synergy tip is oil pulling, swishing 1 tablespoon of sesame or coconut oil in your mouth for 5 to 10 minutes before brushing in the morning. Research from the Journal of Ayurveda and Integrative Medicine found that oil pulling reduced total oral bacterial counts, gingival inflammation, gum inflammation, and plaque indices comparably to chlorhexidine mouthwash after 45 days of consistent practice. Combined with thorough brushing and flossing, it creates the most comprehensive oral bacterial reduction protocol available without a prescription.